Mm-hmm.
Yes.
Okay, so you had an embolization, right?
Mm.
When was that?
July of last year.
So it's more than 1 year.
Yeah.
So what I see here, why you had some suspicion that you may have recurrence? Why you had this?
I've had pain all last year.
Yeah. Okay. In your physical examination, your scrotum, there is a large bumpy tissue, and but when I look with Doppler, you see there is a large vein, and this is unfortunately a recurrence. And look at this crowd of veins, and this is different. You see, these are in the upper part. This is in the lower part. So this is an external spermatic vein.
Okay.
These are internal veins. And you can count these as healed because they are not, look at this thickness and compare it with this one. So the embolization works very nicely for internal spermatic veins, but it has not working because it can't reach, the coil cannot occlude the external veins because internal veins goes into the body through the classic spermatic veins, but this external vein turns with the vas deferens, turns in a shorter course. So they don't follow the same route, same course. So coalization, when they put coil in the embolization, this is missed. They can't stop blood flow in this external vein.
Yeah.
So this is your testicle, and there's a crowd of veins, but these are, let me measure. I can tell these are not thick, they are healed, but the external vein, so it is 1.5 millimeter, good, but this one is huge, and unfortunately internal veins they have too much effect in sperm count. External vein has too much effect on pain. So you have pain. And when we take this vein out, look at this. This is really huge. In my technique, Istanbul, I call it Istanbul Varicocelectomy technique. We take these veins out. They are harmful. People say, when do you take it out? Where is the blood will flow? Is it a problem? No, it's not a problem. Its presence here is a problem. And usually these veins don't have reflux. I will show you color mode now. It's like 5 millimeters. And unfortunately, there's a mistake. You had the Doppler ultrasonography in your country, right?
Yeah.
And they say it is normal. There is no varicocele.
They said I have no varicocele. Yeah.
Yeah, because when you are in laying down position, I will make you laying down in a minute, and they will disappear. So now you are in standing up, and these are visible.
Yeah.
So let me change to color mode. Look, in the color mode, we can see the artery pulsation.
Yeah.
Pulsating artery. There is no much reflux. Strain a little bit. Yeah, when you strain, look, there is no backflow to external veins. Just a maybe small one. So when they don't see the reflux, they say, okay, this is normal. And when they don't see it, they say it is normal, but it is not. So I will make you lay down in a minute.
Should you not see color though for those if there is reflux for the large ones?
For the large one, it's very rare to have reflux.
Okay.
You see these large ones. We don't see very commonly reflux in these veins, but still they cause the pain. When there is no reflux, the sperm count is gradually, it's better. How is your sperm count?
I don't know.
You don't know.
I haven't had it tested.
Yeah. Okay, so it usually doesn't have too much effect on sperm count, but it usually had too much effect in pain. Okay, there are really very large veins. Let me look at the right side now. And one other weak point with embolization, it's not possible to do it to right side easily. So they usually say, okay, one-sided varicocele procedure is enough. Let's do it to left side and leave the right side. But now, when did you diagnose with bilateral? After the procedure? Who diagnosed this?
It was before embolization.
Before embolization, but they
Yeah.
said it's not important. Is it
They
true?
said the right one was pretty small, so
Yeah.
they won't do it.
Okay, so this is your right testicle. When I look to vessels of these testicles, the right testicle, there are prominent veins in the right side too. Do you have pain in the right side? No.
Sometimes.
Sometimes.
Just a little bit.
Yeah. Of course, it is smaller than left side, but still there is some prominent veins here. Okay, so this is the right side, and I can see these around the testicle. There are many. Okay, now I will make you lay down and see what's going on.
Okay.
Position. Look at this vein. It's still there, but it was 5 millimeters. Now let's see. 3.3. So maybe if you lay down more, it will get smaller.
Yeah.
And but still there are some veins. These are, as I say, external veins. The internal ones now seems more easily, and they seem quite healed. Better than when you are in standing up position. They were more prominent. Now they seem quite healed.
Does that mean when you if you do the surgery, then you don't have to go inside the?
Actually, I will look. If there is enlargement, I will check them one by one.
Okay.
And, I will investigate all of this because we don't want you to have a recurrence again.
Yeah.
So these are the external ones. This is the pumpiniform plexus. And there's a large vein.
Yeah.
So I will take them out. In the left side, there's no suspicion you had a recurrence, and in the right side they didn't operate the right side.
No.
And okay, so when I look in laying down position,
Looks okay, right?
yeah, okay, still there is something.
That's a big one.
This is not a very thick one. 2.5. Maybe a little larger, 2.67, but you can consider this as normal. If a radiologist see this and says 2.5, and for embolization they will say, okay, this is not important, this is nothing. But when you are in standing up, it is 3.3 millimeters, and it's not good. So it's better to do a bilateral procedure. Look, this is testicle here, and it's coming close to testicle. These external veins have less impact on sperm count, but still this is not good to have. Maybe in a few years you may have pain here too.
It's that blood flow,
Yeah.
And just with the color Doppler again, we didn't see
reflux. Yeah, for reflux, strain again. Okay, you see there's this is reflux. Normally this must not be seen like this. And you have in the 2.5 millimeter external vein, you have also reflux here. Strain again. Yeah, this is also meaningful. And let me look to left part.
Because I know on the left side for the big one we didn't see the
strain again. Yeah, still there is some significant reflux here too. Look at this. And for the bigger ones, it is really rare to have reflux on these guys. But maybe we can have some little. Sometimes these large vessels, large external vessels, has too much impact on sexual activities. Do you have any problem in sexual desire, erectile quality, such things?
It's definitely changed, yeah, since having varicocele.
Really?
Yeah, less.
I think most of my patients, I don't want to mention this problem too much because it is not scientific to say, to give a guarantee, but really a great number of my patients claim after the operation there's a big change in their sexual activity, erectile quality, desire, everything. We will see if it will happen in your case too. Strain one more time. Look, there's some. It's too large that blood is not coming back. It's difficult for, but in the smaller veins, it is more easily seen. The change in the movements. Yeah, so yeah, you have a significant varicocele. There is also some reflux coming here.
Okay.
Okay. So we recommend you to have a bilateral varicocelectomy, and we will arrange in the following days.
Yeah.